On the suggestion of WHO's Technical Advisory Group on Virus Evolution, WHO recognized the variety B.1.1.529 as a variant of concern, naming it Omicron, on November 26, 2021. This decision was made based on data submitted to the TAGVE that Omicron has many alterations that may affect how it acts, such as how easy it spreads or the severity of sickness it causes. Researchers in South Africa and throughout the world are doing research to better understand many facets of Omicron, and the results of these studies will be shared when they become available. Transmission. The number of people testing positive in areas of South Africa impacted by this variation has increased, but epidemiologic studies are being conducted to determine if this is due to Omicron or other factors. It is unclear whether Omicron is more transmissible, easier to pass from person to person, than other variations, including Delta variant. Prior SARS-CoV-2 infections efficacy. Preliminary evidence suggests that there may be a higher chance of reinfection with Omicron. That is, those who have previously had COVID-19 may be more easily infected with Omicron, compared to other variations of concern, but data is limited. More information will be released in the next days and weeks. Vaccine effectiveness. WHO is collaborating with technical partners to better understand the possible impact of this variation on our existing countermeasures, including vaccines. Vaccines, notably those against the major circulating form called Delta, are crucial for lowering severe disease and death. Current immunizations continue to protect against severe disease and death. Current test effectiveness. The widely used PCR tests continue to detect infection, including Omicron infection, as we have shown with other variations. There are current studies to see if there is any effect on other types of tests, such as quick antigen detection assays. Current treatments efficacy. Corticosteroids and IL-6 receptor blockers will continue to be effective in treating people with severe COVID-19. Other therapies will be evaluated to see if they are still effective in light of the alterations to the virus in the Omicron strain. Currently, WHO is collaborating with a vast number of researchers from around the world to better understand Omicron. Virus transmission, severity of illness, including symptoms, performance of vaccinations and diagnostic tests, and treatment effectiveness are all now or soon to be undertaken studies. WHO urges countries to contribute to the gathering and exchange of hospitalized patient data via the WHO COVID-19 Clinical Data Platform in order to define clinical features and patient outcomes more quickly. More details will be revealed in the coming days and weeks. TAGVE at WHO will continue to monitor and analyze data as it becomes available, assessing how mutations in Omicron influence the virus's behavior. Disease severity. The first reported infections were among university students, younger people who likely to have milder disease, but determining the severity of the Omicron form will take days to weeks. All COVID-19 variants, including the Delta variant, which is dominant worldwide, can cause serious sickness or death, especially in the most vulnerable persons, hence prevention is always essential. It is unclear if infection with Omicron causes more severe disease than infection with other forms, particularly Delta. Preliminary evidence suggests that hospitalization rates are increasing in South Africa. However, this could be due to an increase in the general number of persons becoming infected rather than a specific infection with Omicron. There is currently no evidence that symptoms related with Omicron differ from those associated with other variations. Prevention measures for countries. Because Omicron has been designated a variant of concern, WHO recommends that countries take several actions, including improving surveillance and sequencing of cases. Sharing genome sequences on publicly available databases, such as GISAID, reporting initial cases or clusters to WHO, conducting field investigations and laboratory assessments to better understand if Omicron has different transmission or disease characteristics, or impacts vaccine effectiveness. Countries should continue to use a risk analysis and science-based approach to undertake appropriate public health interventions to limit COVID-19 circulation generally. They should build some public health and medical capacity to deal with an increase in cases. Furthermore, discrepancies in access to COVID-19 vaccines must be addressed immediately to guarantee that vulnerable populations worldwide, including health workers and the elderly, receive their first and second doses, as well as equitable access to treatment and diagnostics. Prevention measures for people. The most important prevention measure is people should keep a physical distance of at least 1 meter from others. Wear a well-fitting mask. Open windows to enhance ventilation. Avoid poorly ventilated or crowded locations. Keep hands clean. Cough or sneeze into a bent elbow or tissue, and get vaccinated when it's their turn. For more updates, make sure to subscribe and press the notification bell.